Hello everybody, welcome back to my channel. My name is Dana and today I am talking about grief, trauma, therapy, healing. Let's just talk about it all. So we're gonna jump in. If you're not already subscribed to my channel, please do so below. I love to talk about lots of things and I think I'm changing kind of a little bit of the direction of my video or of my channel. So if you're interested in just more of life and less of overconsumption, I don't really know what it's gonna look like, but it's gonna look like something and it's gonna be a little different. So if you're interested, I would love to have you and we'll get into the video right now. All right, so you're probably wondering, what am I gonna talk about? Or maybe you were around back at the beginning of the year when I was talking about the grief and trauma that I went through. Well, that's where it kind of starts. The reason I started EMDR therapy, which I will get into later in the video, is because I went through a very, very traumatic month or so. I mean, you know, individually it was not a month, but the actual event was a stillbirth. I talked about this in a previous video that I just put out, but I was pregnant with twins. I was at, 24 weeks and 3 days. I actually had lost my first twin at about 22 weeks, which was also very traumatic, but it was more of a miscarriage. So miscarriage being that, and there, I'm not trying to say one is more traumatic or hard, but they are different. So a miscarriage is, if you don't know, where the baby is no longer alive, but could still be inside of you. And that's what I had. So the first one, we don't know why. I went in for my 20-week, anatomy scan, and they didn't see a heartbeat. And that was really, really hard. But I also was like, well, I have another baby still, and like, I have to be strong. I have to keep going because what am I gonna do? Like, fall apart? No, I can't do that. I still have a baby. And then about a week and a half later, I left for a trip for Boston for my work. I go up there twice a year for work. And I left in the morning. My husband took me to the airport and I was like, hindsight is always 20/20. You look back and you're like, why didn't I do these things? And that's a lot of what you talk about in therapy. And it's that what if game, which is terrible. But I was having really mild cramps, just one cramp, and then it would be gone and I wouldn't have it for a while. And then I was on the plane and I started feeling like, okay, I'm having more cramps. And I didn't even think about it, which in my head now, of course, I'm like, what were you thinking? Like, just going about your day. And then got into Boston, went to the hotel, blah, 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 went out to dinner with my team. And at dinner, I was just like, I didn't say it to anybody, but I was not comfortable. Like, I was having pretty intense cramps and they would come and go, but the duration of the cramp was getting longer, more painful, and there was less time in between. Again, you can say all you want, hindsight is 20/20. As the night went on, I went to bed. I tried to go to bed. I woke up in severe pain. Basically, I was having contractions. And again, I am not young. I have seen a lot in my life. I've been through a lot. But in the moment, sometimes you just can't discern what a normal person would be able to pull out. And in a normal day right now, I'd be like, yeah, you should go to the doctor. You should have gone to the doctor way before that. Again, you just don't know until you're in the moment. Eventually, the story of actually how it happened, I'm not going to get into. That is, for me, just too traumatic, and I don't want to traumatize everyone else. I can talk about it now, clearly, but I don't want to go into the details. That's, I think, something I just will always want to keep private. I've talked to my therapist about that. But I did have a stillbirth. So my baby was actually born alive, and he was on life support for about 24 hours. But he was born so prematurely that it wasn't working. His vitals were getting worse. They had tried everything. We were up in Boston, so he was at Mass General, which is a fabulous hospital, and they have one of the best NICUs in the world. So we did try everything, and it just wasn't working. And also the doctors kept saying, and I know I'm getting into a lot of details, but this is part of my journey, that basically he was born so prematurely. He also had been he wasn't breathing for a little bit in the beginning, and all of that combined, that he would have had such severe, basically like, no, I don't know how else to say it, but like a vegetable, like totally brain dead, all the things, if he's even survived. And so you kind of weigh like what it is. And again, vitals were not doing well. They were getting worse and worse and worse. So eventually we had to decide, and we had to say goodbye, which was an incredibly hard moment. It was like 48 hours of the hardest time in my life. I was also alone in the hospital, or in Boston, until my mom and my husband came up. They took the first flight. So I was dealing with all that. I also then had a, what's it called? A DNC, but I think it's called something else. So, because I had another baby still in me from the first miscarriage. So needless to say, I had a lot of trauma, and I took a week or a month, I think 5 weeks off of work afterward, because my work is amazing. And I started going to therapy, and that is where EMDR comes in. So that's the whole buildup. I talked a lot about it. And now I'm going to talk about what I did to make it so that I can talk about this. Because the first video I put out after it happened, I was crying. I could not talk about it at all. But I'm here today to kind of like show that it can be done. And I just think that this therapy is so beneficial if you put in the work. So EMDR stands for eye movement desensitization and reprocessing. It is a mouthful, that's why it's called EMDR. And it's a form of psychotherapy that is developed to help people who are processing really traumatic experiences. Case in point, what I went through. It also, so the main gist of it is that it uses bilateral stimulation. If you've ever heard of or seen this kind of like thing in therapy, or tapping, some people do it like this. Those eye movements and tappings are what's helping the brain reprocess those memories. And the goal of it all is not to erase the memories, because first of all, that's not possible unless, and I don't think anyone would want that, but it's to reduce the emotional intensity of the memories so they no longer feel so overwhelming or lead to a lot of emotional distress. So another way to think about it is, when you think of trauma, if you've ever had it, like think to a moment where something felt really traumatic to you and like has just stuck in your brain. We say that like offhand, like the trauma, or like it's stuck in my brain, I'll never get it out. But that's actually kind of what it is, and that's what we're trying to get rid of. Because then when you go through life with something stuck in your brain, you're going through your day, whatever, and something triggers you, which I know that's an overused word, and I hate that it's overused, because it's actually, when applicable, it's very important. But when you are triggered by something, say for me, if I am in Boston in a certain hotel, I would be triggered, which when I went this summer, I did not stay in that hotel because I knew I didn't want to. But that is basically going to trigger you into reliving the event or the experience. So maybe like you often hear about veterans where, they were in a war zone and they hear fireworks, or they hear another loud bang. That is the trigger. It triggers their brain to think that they are back in combat. And that's exactly what this is. And so what we're trying to do is get unstuck from those triggers. And so what it actually does during the therapy is that EMDR is going to help activate both sides of your brain during a guided recall of memories. That's important though, because we're not just like willy-nilly talking about them. We're recalling memories in small portions with a lot of resources. I'll talk about that as well. And we're going through the memories to make them less impactful. I keep using the word impactful, but I really mean intense. We're just trying to lessen that intensity. So over time, the memory is still there. It's still very much a part of you, but the emotional charge is lessened. So I wanted to also talk about what goals I set. And I have this list, which my therapist wrote down. And this was in the very beginning. So I started going to her right after it happened. This was in February. And my goal was to be able to check these off my list. And I just found it in my purse the other day. And we also like check up on these goals, but it was really interesting to see what the goals were, because back then they felt so hard. And I was like, I'm never gonna meet these goals. But now I feel like I have met, if not all of them, maybe 2 out of 3. So I'm gonna read them to you right now. The first one is to reduce the frequency of intrusive memories of the birth to less than daily. Like, that's insane. It's also, of course, I was reliving the moment over and over and over. I couldn't sit down, I couldn't read a book. I was reading Fourth Wing or Iron Flame at the time, and I wanted to really enjoy it. I had like a third of the book left, but I literally couldn't stop my brain from reliving that moment. So the fact that now I definitely don't think about it daily, at least the event, the actual triggering moment. I think about all of it because it's a much bigger picture now, but I'm not thinking about it daily on repeat, like on a loop. The second one is to feel empowered when feelings of sadness, anger, and worry come up. So that's also something that the therapy has really, that's a broad goal, I would say. And this therapy has really helped me to kind of hone in on my emotions. I think we can all benefit from that, even if you haven't had a traumatic moment or experience, because when any strong emotion, be it sadness, anger, happiness, come up, to be able to categorize it and actually see it for what it is, and then also then take a moment, take a beat, and to say this is a moment. This is not going to define my life for the rest of the time. I'm not going to be angry forever, but to let yourself feel it. That's what I do. And then also kind of the rational part of your brain to be you're going to get through this. It's going to be okay. You're going to feel sad. You can feel that, whatever the moment is, and to really have a bit more control than letting it, again, spiral out of control. And then the third and last one is to increase confidence in my self-advocacy with medical providers. If you've ever been in a hospital or, having kind of a reoccurring medical issue or whatever, you know what I'm talking about. It's not in America, and maybe in other countries as well. I only know the American medical system, but you are made to feel less than, and it's not intentional by all doctors, but they unfortunately are busy. They have a million charts to do, a million things to do. They are slammed, and that sometimes comes at the expense of you being heard and advocating for what you need. And sometimes it's hard also because you don't know. I'm not a doctor. I don't have any medical experience, so I don't always know what questions to ask. And so sometimes you need to have an actual conversation for those questions to come up. And so for me, I have gained a lot of confidence in the medical setting, and I'm no longer kind of just a passive participant. I still have a long ways to go because I'm not the most aggressive person, but I feel like that one for sure is a really tangible thing that I'm going to take throughout my life, even just after this moment in time. So those are the goals that I set, and I am very happy to say that I think I have achieved on some level all three of them, which is why I have transitioned from having EMDR therapy once a week. Then I had it every other week, and that took a while. That took 3 to 4 months, and it's work. Afterward, you're just ugh, I'm tired, I'm dead. So every other week, and then I did monthly, and now I'm at the point where it's going to be every other month. I also have another therapist who I do cognitive behavioral therapy with, and so I do 1 month with her and then 1 month with my EMDR therapist. So I'm still seeing them, and I don't think I'm going to quit anytime soon, but it's definitely less than I was seeing her at the beginning. So what does EMDR kind of look like and feel like in practice? I think that's probably something, if you've never done it, first of all, it's going to look different depending on your provider and probably depending on what you need. So for me, a lot of my sessions start with just kind of conversation. How's it going? What's going on? And either I'll talk about something that has less bearing on the actual practice that we're focused on, or sometimes if it's been a stressful week, I will go right into kind of things that have come up. And we talk about that for a while. And then depending on if we're doing the reprocessing or the desensitization comes first, and then the reprocessing comes second. So we spent a lot of time with the desensitization, and my therapist, and again, I'm not speaking for every EMDR therapist or every session, but this is the way that we did it. We kind of built a toolkit, and we called them my resources, and they could be real, literal things that was an actual resource. If this mug makes me feel safe and secure, that could be a resource. For me, it was things like I have this recliner in my office, which is where I go to decompress after a meeting, or just after the day, I'll read a book there, that kind of thing. Or I had resources that were fictional. So I was reading a series of books back in February, March, and one of the characters in the books was just this like really like tall, strong, I don't know if he was tall actually, but in my mind's eye, he was tall, he was strong, he was a Roman guard. He became a resource for me because I just thought of him and I felt really, really safe and secure. So when we started getting into the actual reprocessing, I could pull up those different resources, and maybe not always in therapy because I couldn't just be in my recliner chair to feel safe, but I could think about it like, oh, afterward I'm going to go sit in it, or this character is over my shoulder kind of protecting me. So we would go through a lot of that building of resources for me. And then at a certain point when it came time to the desensitization, that's when the bilateral stimulation comes in. And my therapist would take her finger. We could do it in person or online, which is really cool. And she would go back and forth, not talking, just back and forth. Or I would tap, and I always cross my arms. I don't know why. And then afterward, we would talk about the process and the emotions that came up and kind of just check in on what's going on. And we would do that over and over about kind of like build off of what I had talked about after the desensitization or the reprocessing. And as you go, it doesn't happen overnight, but you just kind of feel yourself like taking a deep breath. And we did work on breathing exercises as well, but you just feel a little bit lighter in the memories, and they still can come up and be really emotional. And I still cry to this day, of course, but they don't feel stuck in my brain. I feel like I can kind of like move through them. I don't know if I'll find the visual, but my therapist shared this visual, and it's actually a video, which I will link below, of the river. I forget what it's called, but it's a wonderful, wonderful analogy. It basically is like you're going down a river and you can go up and down and like float too close to this part of the shore or this part. And this side maybe is like heightened anxiety. This side is like more depressed. And the goal is to kind of be in the middle of the river. Anyway, I talk about that a lot when I'm in therapy because I relate to that fluctuation. So I will insert that if it's helpful for anybody. I think it's worth a shot, and go enjoy that or view that. I don't know if you'll enjoy it, but you know what I mean. The other thing I did want to talk briefly about is just the history of it, because you probably haven't heard of it, or maybe you have, or maybe you've heard of someone else doing it, but it was developed in the 1980s, which is really, I mean, it doesn't feel that long ago for me. I was born in the 80s, but it's more recent than a lot of therapies. Like talk therapy has been around quite a bit longer. And it was first tested on veterans and trauma survivors, which again makes perfect sense because you need something that was really, really traumatic to kind of help deal with these emotions. It's now recognized by groups like the American Psychiatric Association and the WHO for effective use for PTSD. So that's just a very brief history. I don't think that part for me is as interesting as the actual methodology. But I'm going to insert as many links as I can below if you're interested in learning more about it. But also you can just type in EMDR to Google and a lot will come up. So just to wrap up, I guess my final thoughts, first of all, healing and trauma is all very, very personal. And the fact that I could do this whole video, I'm looking at the time clock on this video, in me for real time, it's 21 minutes. The fact that I can talk about it like I'm at a work meeting is pretty impressive, because if you saw my first video after the stillbirth, I wasn't functional at all. And that's totally normal. Like I have worked through this a lot, and I'm not going to ever be at the point where I'm totally like boring, or not boring, that's not the word. Like no emotionless, because that's not real. Like I still have emotions, and that's not the point to be emotionless. But I have just come so far in feeling like I have a handle on things. I control them. The situations and the emotions don't control me. So if you are struggling with something that was traumatic, or just you feel like this could be useful, I would definitely suggest looking for EMDR professionals in your area. I'm not a doctor. What I say here is just my personal experience, but I do think it's very, very helpful. And I think for a lot of people, it can be kind of life-changing as it was for me. And then the last thing I just want to mention, as I've mentioned a few times, but healing is not forgetting. I think that's really important, because if you come out of this video and you're like, oh, she doesn't even care about it. She lost both of her twins and she's like emotionless. It's not at all what it is. It just softens things. It makes it like palatable in a sense. Whereas before, the emotion was so strong that I wouldn't be able to function. This makes it so that I can talk about it, I can feel the emotions, but they don't control me. So you move forward with still honoring the trauma and the experience that you went through, and I think that is so important. So that's wrapping it up. This was a longer video, but I hope you enjoyed, and I will see you guys in the next one. Thanks for watching. Bye.